Good evening, everybody. Hope you all are doing well. Thanks for joining in on the session. So, once again, there's a lot of information in this case, but I'm going to try my best to try to cover kind of the most important things in preparation for the examination. Okay, so meningitis. Okay, so I would like to start off with the first branch of meningitis, and that is the causes of meningitis. Okay, so firstly, very broad overview, right? So I like to classify it as acute and chronic. So in acute, you get bacterial causes of meningitis, you get viral causes, you get fungal causes, and parasites. Okay, and then for the chronic meningitis, you get um, the fungal one, which is Cryptococcus neoformans, syphilis, and TB. TB is very important in the South African setting as well. Okay, so let's start with bacterial causes. Now, you need to understand that the bacterial causes, and approach to the bacterial causes, you get in terms of dividing it into the different types of age groups, right? So we start with the neonates, okay? So neonates essentially from 0 to 28 days old, okay? So they tell you a patient um, recently born presents with fever, neck stiffness, right? What is the most likely organism which cause that particular um, meningitis? Okay, and the baby has all of those other symptoms of meningitis. Okay, um, vomiting as well. So, what are the causes under the neonatal aspect? So we have the group B streptococcus. Okay, some we just kind of abbreviate it as GBS. Okay, so GBS that's the group B um, strep streptococcus. Okay, and then second one we have is Listeria cytogenes. Okay, right, and then third one under the neonatal population is E. coli. Okay. Um, I'm just seeing quickly over here. Um, yeah. So I just want to mention regarding the group B streptococcus, right? So um very important. How does the baby get how does the baby get infected with the group B strep? So there's vertical transmission from the mother to child in childbirth, and GBS is you also have GBS colonization in the maternal genital tract, right? So basically during childbirth, okay? So either via vertical transmission, so the group B strep, in terms of the transmission, you could have it either via the vertical, basically vertical transmission during childbirth, okay? I'm just gonna person English. Okay. And then I would like to mention the E. coli. Okay, so the E. coli is also vertical transmission during childbirth, and neonates are kind of exposed to E. coli in the maternal genital and gastrointestinal tracts. Okay, so E. coli as well. Okay, vertical transmission. I'm just gonna branch that. Okay, and then the listeria, also vertical transmission, in which it can cross the placenta barrier and infect the fetus or be transmitted during childbirth. Okay, so just put there. So kind of the key thing to remember is the vertical transmission. Okay. Okay. Now moving on to oh yes, also with regards before I move on to the babies and children, you need to kind of also keep in mind that you can also get gram-negative bacilli as well as Staphylococcus aureus, right? So if a neonate is in hospital, right, the neonate can also get hospital-acquired infections. Okay, so I'm just gonna make just a mental note over here in hospital. Because sometimes if the question is kind of specific to, okay, this neonate was in hospital and you're kind of thinking on what are the possible in, in, in the multiple choice, what are the possible organisms, and in hospital babies are kind of exposed to your gram negative bacilli, okay, your gram negatives as well as the staphylococcus aureus. Okay, so we just have to just put this in here for completion's sake. Okay, staph aureus. Okay. Um, and then also you also get nosocomial infections, particularly in preterm infants, caused by the Enterococcus species. Okay, so I'm just gonna also just mention that for completion's sake. Right, nosocomial Enterococcus species. Okay, cool. Now moving on to babies and children. So more than 1 month till just before the teens. Okay, what are the organisms involved? So we start with the main organism, and that is the strep pneumonia. Okay, Streptococcus pneumonia. Um, Streptococcus pneumonia. Okay. Second one is Neisseria meningitidis. Okay, very, very common. Neisseria meningitidis. Third one is Haemophilus influenza type B. Okay, Haemophilus. All right. Just someone's in the waiting room. Okay. Uh, okay. So Haemophilus influenza type B and also group B Streptococcus. So GBS kind of also presents in your babies and children as well. Okay, now I'm going to speak about the Streptococcus pneumonia. So, Streptococcus pneumonia essentially this colonization of the nasopharynx, right? Young children have increased exposure to respiratory pathogens and they have less mature immune responses, okay? Because obviously the immune system is still kind of busy developing. So I think I'm just gonna branch over here and just mention as a keyword colonization of nasopharynx. So nasopharynx colonization, okay? Um, with the Neisseria meningitidis, you have it's a respiratory transmission in crowded environments such as daycares and close contact with carriers. Okay, so kind of one of the risk factors for the transmission of that is your crowded environments. Um, you just see quickly, yeah. Yes, I'm just gonna mention over here crowded environments. Okay, and then just see quickly. Okay, cool. And then the Haemophilus influenza type B, it's also a respiratory transmission and historically a major cause before widespread vaccination. Okay, so all these babies also get kind of vaccinated to prevent all of these infections from occurring. Okay, so yeah, so just want to mention that. for now. Just want to see if there's anything that I missed under the meningitis. Okay, so in terms of transmission, okay, so the Neisseria meningitidis, as well as your Streptococcus pneumonia, okay, as well as the Haemophilus influenza, okay. So the transmission is essentially through the respiratory droplets, okay. So I think just going to mention just like a side note. Just see quickly over here. Hashtag respiratory droplets. Okay. 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 Moving on to the teens and the young adults. So common infections is the Neisseria meningitidis as well as the strep pneumonia. Okay. Neisseria meningitidis and strep strep pneumonia. Okay. In older adults, you see over there. Okay, cool. In older adults, you get the is pneumonia, right? Strep pneumonia, as well as the Neisseria meningitidis. Okay, and then your Haemophilus influenza type B, so that's HIB. And then group B Streptococcus as well, and then Listeria monocytogenes. Okay, so I'm just gonna say L mono. Okay, that would be our abbreviations. Okay, so that's kind of the bacterial aspect. Now, in terms of treatment, because they love to ask treatments with regards to certain pathogens. So one of the common treatments that they love to ask, first one is the Streptococcus pneumonia. Um, just see quickly. Yeah. So I'm just gonna maybe use a different color. Okay. So treatment for Streptococcus pneumonia includes your so if the patient is penicillin sensitive, right? You can give IV penicillin in the form of ampicillin. Okay. So in terms of treatment, you can give IV penicillin in the form of ampicillin. Okay. Um, right. If the patient is penicillin resistant, right? Patient is resistant to penicillin, you can give your IV KIF, right? IV KIF triazone, right? Um, if the patient is ceftriaxone resistant, your third line of treatment would be IV Vanco plus ceftriaxone. Okay, IV vancomycin, um, vancomycin and cef. Okay, so first line pen or rather first line MP. So it's MP, KIF, Vanco, and KIF. Okay. Um, cool. So that's that. And then, okay, the duration of treatment, just in case they ask it, would be 10 to 14 days. Okay. So just going to put here 10 to 14. Okay. Now going on to the, oh, sorry. I also have to mention the prevention of the Streptococcus pneumonia is very important. Okay. Now, prevention is in the form of the vaccination. Okay. It's very important to understand there are kind of two types of vaccinations available. You have the conjugate vaccine, okay, conjugate conjugate vax, as well as the polysaccharide, vax. Okay, polysaccharide. vaccination available. Okay. Okay, moving on to the Listeria monocytogenes. Treatment for that is MP plus minus Genta. Okay. Um, where is that now? Okay, can over there. Okay, cool. So treatment for that um would be MP and okay, MP plus minus Genta, gentamicin. Okay, and that is for 21 days. Okay. Oh, someone moving the table. Probably a mistake. Okay. Okay, so where was I now? Yeah, so Listeria monocytogenes, the number of days of the therapy would be 21 days. Okay, so that would be 21. Okay, now moving on to Listeria meningitidis, treatment for that. Where is that now? Here we go. Okay. Neisseria treatment for Neisseria meningitidis. So Neisseria meningitidis, you give IV penicillin. Okay, IV. Just gonna say the IV pen for 7 days. Okay. Generally, ceftriaxone is kind of also used as well. So I'm just gonna mention cefti as well. And the duration for that is 7 days. Okay, so I'm just gonna put this 7. Um, okay. Hemophilus influenza, definitive treatment there is IV KEF. Okay, so Hemophilus influenza, IV KEF, and that is for 10 days. So IV KEF for 10 days. Cool. Okay, I think we can move on to, just want to see if I didn't cover everything. Okay. Um, okay, cool. Now we're going to move on to viral quickly, right? So the two viral causes of meningitis, you have your, just see something quickly. Okay. So two viral causes, you have your enteroviruses, right? Enteroviruses, as well as your herpes simplex virus. Okay, so herpes simplex virus. Okay, that's your HSV. Okay, now the enteroviruses is very common amongst children. Okay, so kind of one of the risk terms of you want to speak about risk factors for both. Um, Basically, I'm just gonna put here children. So it's very common amongst children, and the transmission is fecal, oral, and respiratory droplets. Okay, fecal, oral, um, and respiratory droplets. So that's in terms of the transmission. Oopsie, transmission. Okay. And let me just see what else is essential. Okay, so I think that's fine. And then with the herpes simplex virus, again, more common in adults. Okay, and especially it's the HSV2. Okay, HSV2, common in adults, and transmission is through direct contact with infected body fluids. So direct contact, infected bodily fluids. Okay. Um, yeah, that's fine. Now moving on to fungal. Okay. I'm gonna leave cryptococcal neoformans when you speak about the chronic meningitis. Okay, I'm gonna skip fungal for now. Let me rather go with the parasites, right? Now, the parasites have two umbrella terms. Under parasites, you have protozoa and the metazoa. Under protozoa, you have your the Plasmodium sulfurpyrum. Uh, just double check. Yeah, falciparum. Okay, so we have and we all know that the Plasmodium falciparum, uh, Plasmodium falciparum causes your malaria. Okay, so this is kind of leads to that cerebral malaria, which leads to your. They kind of say that it resembles a meningitis. Okay, but yeah, it kind of resembles a meningitis pattern. So that's the Plasmodium falciparum. And then the second one is Toxoplasma gondii, right? Just see. Toxo. Okay. And then the metazoa for the worms, you have flatworms and roundworms. Okay. Flatworms. And the flatworms, very important one is the Taniosolium. Taniosolium, and the Taniosolium is what causes neurocysticercosis. Okay, neurocysticercosis, neurocysticercosis. And then opposite to flatworm is obviously your roundworms. Okay. So, speaking about the neurocysticercosis, um, how do you treat the neurocysticercosis? So you give antiepileptics, okay? Just do it over here, okay? Treatment for that includes antiepileptics, which is very non-specific, and then the direct therapy is that of I mean anti-helminth therapy, okay? Kill those worms, okay? Anti-helminth, anti-helminth, anti-helminth um, therapy, and for example, albendazole. So albendazole, um, plus minus your praziquantel, praziquantel, okay? So that's treatment for your neurocysticercosis. Um, okay, let me just see quickly. Okay, and then fungal. Under the fungal component, um, you have something called the rhinocerebral fungal infection. Okay, uh, rhinocerebral fungal infection. And treatment for that would be surgical surgical debridement. You see quickly. Case treatment for that would be surgical debridement as well as amphotericin B. Okay, amphotericin B. Okay, so now we're going to move on to chronic meningitis. Okay. So the first type of chronic meningitis I would like to speak about is that of the Cryptococcus pneumonitis. Okay, just want to orientate myself quickly. Um, just see something. Okay, cool. So Cryptococcus pneumonitis, what are the important things to remember under here? So in terms of the prevalence, it commonly affects immunocompromised individuals, especially those with HIV/AIDS. Okay, so kind of in terms of the risk factors, let me just read this with treatment. Just keep the black, okay? So kind of the risk factors for the Cryptococcus pneumonitis, right? Importantly, the in the HIV population, okay? Um, and in terms of the transmission, okay, in terms of transmission, um, it's acquired from the environment, particularly soil contaminated with bird droppings. Okay, so running out of time. Oh no. Soil, okay, just gonna go a bit faster. Soil with bird droppings. Okay. Um, okay, just see quickly. That's fine. So that's that. And then the syphilis or neurosyphilis, I forgot to mention the treatment for the cryptococcal neoformans. Okay. So treatment for the cryptococcal neoformans, you see over there. Okay, cool. So treatment for cryptococcal neoformans. So we have antifungals. Okay, antifungals, right, which includes amphotericin B, amphotericin B, as well as flucytosine. Okay, flucytosine. Yeah, so I think basically that is, yeah, that's essential basically to remember under the treatment for the cryptococcus neoformans. Syphilis. Okay, moving on to neurosyphilis, right? So essentially the organism involved over here is the Treponema pallidum. Okay, as we all understand, remember. So Trepo, Treponema, so Treponema um, pallidum, the organism which causes the syphilis. Okay. What do we need to things we need to understand? So fit individuals with untreated to untreated syphilis. So again, another risk factor is essentially HIV, right? In the HIV population, you would find it more common over there. And in terms of transmission, you could either have a sexual transmission or something called a congenital syphilis, and that's the mother to fetus transmission. Okay, so in terms of transmission, we have uh, sexual transmission or mother to child transmission. Okay, and then let me just see quickly if I didn't miss anything. Okay, that's fine. Treatment for neurosyphilis would be the IV penicillin. Okay. Um, yeah. Okay, so treatment, just use that. Okay. So treatment would be IV pen. So put the IV pen, and number of days is 10 to 14 days. Okay, 10 to 14 days. And then if the patient is have a penicillin allergy, we could use ceftriaxone, okay, as an alternative. It's just gonna include there. But Kepler-Axel is kind of less sensitive. Okay, just gonna do that. Okay, cool. So moving on to TB meningitis, again, very important in the TB population, and again, one of the risk factors that are involved in TB meningitis is that of HIV. Okay, just use that there. Okay. So TB meningitis affects individuals with pulmonary TB. So if the patient already kind of have existing TB, the TB can obviously spread hematogenously um, to the brain, okay, to causing the TB meningitis. Okay, so patients with um, pulmonary TB and more common in the HIV population, and that's why I'm going to put here HIV, okay? And then the transmission of the organism involved, let me just see quickly. Transmission is obviously the respiratory droplets of the Mycobacterium tuberculosis organism. Okay. Okay. And then in terms of, let me just see quickly. Yeah. Okay. In terms of treatment for TB meningitis. Okay. Um, just see over there. Okay, cool. So the cover is important. If the patient is rifampicin sensitive, so there's two types of phases. You have an intensive phase and a continuation phase. Okay, let me just do. Okay, wait. Um, rifampicin sensitive. Okay, so you have two types of phases essentially. Okay, you have your, let's see, the intensive phase and the continuation phase. Okay, so for the intensive phase, it's the RHZE um, combo. Okay, the RHZE combo. RHZE. And then for the continuation phase, it will just be the RH combo. Okay? For the continuation phase, it's basically just the RH combo. Okay? So the R is rifampicin, the H for isoniazid or INH. Okay? Um, isoniazid. Um, the P for, I don't know why I say, okay, there's another one actually called ripe. I think we can rather just remember it as ripe. I think that's better to remember than RHZE. You just put the, yeah, so RIPE and then RI for the continuation phase. Okay, so isoniazid and then pyrazinamide. So pyrazinamide, and E for in ethambutol. Ethambutol. Okay. And then, okay, R and I for the continuation phase. And the duration for the intensive phase is 2 months. Okay, so the duration for the intensive phase is, just put the 2 over 52 for 2 months. And the continuation phase is 6 to 9 months up to 24 months. Okay, so essentially 6 to 9. Oh no, sorry, it's supposed to be over 12, not that's weeks. Okay, so 2 months or 6 to 9, or six to 9 months, and it can go essentially, the continuation phase can go up to 24 months. Okay, so that's the classification of an approach, okay, to the causes of meningitis, okay? The Zoom meeting might end soon, but I would like to explain in the next session um, the investigations for meningitis, okay? So the lumbar puncture we will do. We need to know the contraindications and complications, and then try to understand all the 10 types of uh, interpretations or things we need to look out for on the CSF. Okay, so and then hopefully in the last session, um, which is quite challenging, is to understand viral CNS disease and pathogenesis, clinical presentation, diagnosis, and treatment.